we are seeing that there's a lot happening in current affairs with the Black Lives Matter movement. So people are feeling compelled to go and be heard and be seen, but to go out en masse as people are in an environment such as this must be the worst nightmare of a doctor who's then having to deal with the aftermath should there be a spread of COVID in those particular bases. Beyond that sort of broad umbrella, Dr. Jerry, tell me your thoughts around the quality of healthcare in African American communities particularly, because this is something that's become quite topical, where people feel that there's a disproportionate number of Black people dying from COVID-19, and that may well be due to some systematic, some fundamental issues in the way that care is provided. What are your views on that?
Yeah, no,
and I appreciate that this is a sensitive issue. I respect that, but I'd love to hear what you think.
It is, but it's the topic of the day, right? And we have to address this. From our perspective, there's been disenfranchisement, which of African Americans, Black Americans in this country. It's not just in terms of the care that they get, but it's from a socioeconomic standpoint to the point of, do they have good health insurance? It's an interesting thing whereby if you don't have health insurance, people are fearful to go and seek care from doctors because of the financial cost of it if you don't have health insurance. So then that leads people to delay care and eventually come in when they're very ill. So I think that plays a role in people having worse outcomes, is that they delay their presentation. In terms of actual providers providing bad care to Black Americans, that it is a loaded question, but I think it's a question that needs to be asked. There's a lot of intrinsic bias tests that are going out now whereby we're asking ourselves as physicians. Obviously, I don't know of any physician who would say, oh, I want to treat this Black person worse. In the UK, this Black or Middle Eastern person badly, or whoever it is, whichever country it is. I don't know of doctors who go into this thinking that's what they want to do. But we have these intrinsic biases that make it so that potentially we're giving better care to certain people, be it based on their color or their socioeconomic status, or the fact that they're wealthy enough, they have family members available who are asking these questions for them. So all that to say, I think there is within the medical community, and it's a tough thing to say, but I think we potentially do treat people differently based on their color, based on their socioeconomic status. I've had to reevaluate myself, and I, the other day, took one of these intrinsic bias tests to see, do I have this bias that I'm not aware of, that's not external, but potentially affects how I give care to people.
My shock came from reading a statistic that pointed to Chicago and stated that while only 1% of the population is African American, 70% of COVID-related deaths are from that African American community. So that really does strike a chord. What is going wrong in care? Is it that we're not seeking, as you quite rightly point out, because there's no medical insurance, or is it just negligence on the basis of going to highly dense hospitals where you're contending with gunshot wounds and triage emergency type issues, so that COVID person comes in, goes back because they can't be bothered to deal with all of that? But this is quite a deep social issue that I'm not sure could ever be answered on a panel such as this. I just thought it'd be interesting to talk to it.